Hi, my name is Julie Paik, and I'm an Associate Professor of Medicine in the Division of Rheumatology and Director of Clinical Trials at the Johns Hopkins Myositis Center. I also have another hat where I also am an investigator and provider at the Johns Hopkins Scleroderma Center. My research focus has been in the neuromuscular manifestations of overlap myositis, truly at the intersection of scleroderma and muscle disease or myositis, for the past 12 years. Currently, this project that I'm working on specifically delved into the risk factors associated with the development of myopathy in scleroderma and also the outcomes of those patients, including mortality and disability. We looked at our robust scleroderma research registry of close to 4,000 patients and found those patients who had skeletal myopathy in the past 30 years, so inception of the scleroderma cohort. We found close to 700 patients who had a diagnosis of skeletal myopathy in our scleroderma registry and clearly and rigorously phenotyped these patients to evaluate what type of myopathy these patients had. Most of these patients had true overlap myositis, such as dermatomyositis or necrotizing myopathy, that was evident on muscle biopsy. But the key take-home point of this study was that these patients had a higher disease burden and higher risk of mortality. These findings and the implications of this study highlight that while skeletal myopathy is underappreciated, it is truly important to recognize if a patient has muscle disease in order to clearly treat them and tailor their treatment so they have better outcomes and better disease trajectory. Thank you.